And thank you for joining us for this new segment, 8 Minutes of Expertise. Today, I bring in the Public Health Administrator for Winnebago County Public Health Department, Dr. Sandra Martell. Dr. Martell, thank you so much for being with us here today.
Thank you for asking me to join you.
And we have a lot of questions people want to know about, and you are one of the top experts here for this COVID-19 pandemic. So the first thing I wanted to ask you is the state says the rate at which COVID-19 cases are doubling is slowing down. So is that true as well for Winnebago County?
Well, we're continuing to watch that. I will be honest with you too, as more testing becomes available, it's kind of a balancing act. We know at the beginning of the week, we had one of our providers in the community, Physicians Immediate Care, began rapid testing. So we're starting to see results coming out of those sites. As more testing is provided, we expect to see some more cases popping positive or testing positive. So we're watching both the case rate of doubling as well as the total overall cases versus number of tests that are out there in the community. So we model it every day. We see it. So a little bit of flattening earlier in the week, but we are seeing some more positive today. So I want to tell the community what you're doing every day to stay put, stay home is having an impact. And we know that because we would have projected higher. So that's the positive side. But we continue to have positive cases and we continue to work this every day along with the state. As you know, they're kind of in a little bit of a plateau more than a complete downturn at this point. So that's what we're really trying to get to, is that kind of, I'm going to call it, where we kind of straight line it across rather than an escalation or an increase every day.
And you mentioned the testing. Governor Pritzker has said he wanted to get to 10,000 tests a day. How many tests are we averaging per day, and where would you like to see that number per day?
Well, again, we've been averaging approximately between 150 and 200 a day, depending upon, beginning obviously a lot less than that. But if you kind of, when you put some estimates out there and you think about if 20% of the population may have the disease at some point in time, you'd want to get out there and start really getting some penetration across all areas. Initially, it was people that were only symptomatic. We know that as individuals are staying home more, they're not seeking care as frequently. And so that also determines testing. So we're very concerned about communities of color, as every major metropolitan area is as well, to see, are those access to testing, is that available to all of our community residents and members. We are working to look at standing up other testing sites as well. Crusader Community Health has provided walk-in urgent testing at all of their locations, so their populations can also be tested, as well as all of our health systems continue to test. And then I talked about Physicians Immediate Care. So the idea would be that as we have better confidence that the majority of our population that is symptomatic and is able to get tested is being tested, we have greater confidence then in understanding what those numbers relate to in terms of the percent of our population that's infected.
So how close are we to reaching our peak of COVID-19 cases?
Well, we projected, and we continue to project a little bit later than the state, more toward the end of the month. But again, as we are able to ramp more testing up, again, that modeling is based on number of tests positive. And that's the limitation of what we have to work with at this time. So as more testing capability comes online, and as more of our residents who are demonstrate illness and need to be tested receive tests, we can have a better sense on that timeline. Can we move it closer? Is it a little earlier than later? Ideally, because I know so many people are, I'm going to say angling. It's, April 30th can't seem to come soon enough for all of us. And so, but we want to make sure that we're able to come out and that we don't have breakout outbreaks and infections. So our goal is to really make sure we have a good handle on how many people in our community have had the illness, what the, transmission rate in the community is, so that we can then plan for that recovery phase as we come out.
Let's talk about recovery. The Blood Center is asking people who have recovered from COVID-19 to come in and donate plasma. So is the health department participating in this in any way, maybe contacting people who've had the virus and encouraging them to donate?
We do not do a direct contact, kind of explaining this process. When you are a case of COVID-19, you're put into a system called the INED system, which is a statewide reporting system that's used for all communicable diseases. When we are done and you've come through your period of recovery, what we do, close the case in the INEDs. Then the state confirms that, And every individual who's a closed case then receives a packet of information from the Illinois Department of Public Health. First of all, there's kind of a little bit of survey about, some things that went on during their illness, a little bit more so we can learn more about the illness itself and maybe some of their experiences and symptoms. And then it also encourages them and gives them information about plasma donation. We understand that that's a very important, part and component piece that's going to be coming online as well. So we work to make sure we close the cases in a timely manner so the state can review them. And then if clients have any calls or want to talk to us about it, we're certainly able to provide them with additional information. So we encourage any of our recovering individuals who are able to donate plasma to do so.
And there has been a lot of buzz about potential treatments for this virus. Is there anything patients are getting now that is seeing success? Are immunosuppressing drugs actually helpful? Hydrochloroquine, all those things?
We continue to monitor that. We know that there are some trials out there on the different antivirals. We heard about some of the, vaccines that are, there's, I'm going to say really working toward pushing that out because again, and also different, I'm going to say treatments that are being used by care providers of individuals, not so much necessarily to cure the disease, but better to, as we do, provide supportive care. What kinds of things help or support the recovery versus may prolong it. So we continue to watch the research out there. We know when I think about how rapidly even just the different types of tests have come out, we started with only the PCR, very limited capability, now to a rapid PCR. And now there is some antibody testing on the market. And of course, looking at how that plays and how we can tell what that means, as well as what other kinds of supportive care have shown to help patients recover sooner and without consequence. As we continue to watch and go through this pandemic and learn from our colleagues throughout the nation and throughout the world, frankly. I mean, we're learning much of the information that's coming out now is coming out of things not only from China, but certainly Italy and their experiences. So I am hopeful and confident that we will begin to take a look at what's available and hopefully make sure that that is available to our residents and our community as quickly as possible.
And we have just enough time for one last question. When restaurants eventually reopen, is the health department going to issue any certain guidelines that those restaurants have to follow? Is anything going to change?
I think, we're all watching this nationwide. Obviously, when people talk about it, I don't think, and none of us is looking at a model where everything suddenly is the way it was before the pandemic. So it might mean spacing out between tables. I've heard some, proposed, temperature taking. I'm not sure that that's something that we want to go, but we certainly would want to make sure that there's social distancing between parties, that reservations are taken. Remember, that was a big concern we had at the beginning, because if we're talking about the importance of any kind of contact tracing, should there be an investigation, it's important to know who was at the table, who was around that at that time, so we can quickly identify and isolate and quarantine those individuals that may have been exposed. That's the kind of what we will really be ramping for as we look at reopening and that gradual process.
Dr. Martel, we thank you for being with us here tonight for 8 Minutes of Expertise.
I want to thank our community for all their support during this very difficult time of the pandemic.
Thank you, Dr. Martel. And now let's get a check on our weather with Chief Meteorologist Alex Kirchner.